Cholesterol, very important in managing heart disease and risk factors even before then. LDL is your bad cholesterol, HDL is your good cholesterol. What kind of numbers should we have? Lower the better. As your LDL goes up, your heart disease risk goes up. So it matches. If you have a higher LDL, the heart risk disease goes up. Also, if you have a low HDL, that's bad for you as well. This graph or slide just shows if you are at risk but don't have heart disease or diabetes as a guideline where your number should be. If you have 0 to 1 risk factor, under 160 for your bad cholesterol. If you have already 2 or more risk factors, now those risk factors are the ones that we had talked about at the beginning. You know, being a male, being a smoker, having high blood pressure, those types of issues. So if you've got 2 or more, you already should be below 130. And if you have a greater than 20% risk, then you really should be under 100 in terms of your LDL numbers. Now, if you have heart disease, and we consider diabetes a heart disease risk equivalent, that means it's equal to as if you had heart disease. Your LDL is of a great concern to us, and that should be really pushed down well below 100. Current guidelines for optimal control would be 70. And again, just a review of the risk factors as we had been talking about them: advancing in years, having a family history, smoking, blood pressure issues, looking at that low HDL that I mentioned, and being a diabetic. Those are all risks. Diabetes is a definite risk because people with diabetes have a host of other problems, and their incidence of developing other issues are greater than a non-diabetic, like being twice as likely to have high blood pressure. And heart disease is the leading cause of death in diabetic patients. And diabetes is moving upwards in our country. More than 20 million people have it. Type 2 diabetes is what I had mentioned earlier, and it accounts for a greater portion of diabetes in our country, nearly 90 to 95%, and it is more prevalent in the elderly. So we have to pay attention to our high glucoses and take care of that. This is just a graph just taking a look at diabetes being treated and controlled and not treated. So that's that type of graph. And then taking a look at hospitalization costs. Again, as I mentioned, heart disease is a big factor. 2/3 of patients who have diabetes go into the hospital for cardiac-related problems, cardiovascular issues. And I do need to mention a point about women, because heart disease is the #1 killer of women, more so than all forms of cancer, including breast cancer. So we need, as women, to be aware of heart disease as a definite risk factor in our lives. Smoking, what can I say? It's the #1 preventable cause of premature death. Now, smoking, the choice is yours in terms of this slide. You're taking a look at 4,000 chemical compounds and the even high risk in side stream smoke. Looking at your weight, we talked about before the graphs and how prevalent it is in our country and our world, and these are the numbers we want to stay away from. Over 25 to 29 is considered overweight. Over 30 and above is considered obese. And why is obesity so important is because it ties into many other healthcare issues, including the diabetes that we talked about, having high blood pressure, having any cardiovascular disease. Some cancers, arthritis issues, especially of the weight-bearing joints, it becomes so difficult. And then the increased death risk from blood pressure issues, heart disease, and kidney disease. It's all a balance, but if you eat 100 more food calories per day than you burn, then you'll gain about 1 pound in a month, every month. So be active, take a walk, do things. How much? At least a half an hour a day. Some type of brisk exercise. You don't have to run a marathon. You don't have time to walk for a half an hour. Okay, you're busy, you're gonna need to go to the grocery store after work. Park the furthest away that you can park. Take a little bit of a hike on the way to the store. Walk briskly as you go up. Other people just think you're on a mission and that you've got a purpose in your life. And if you can't exercise for a half hour, do 10 minutes if that's all you can do. Break it up if you need to. Any and every activity is helpful. We need to follow, and I mentioned the word diet earlier. It's not more of a diet, it's more of a change of a way of life. And the DASH eating plan is a good plan to follow, and you can look it up online. And what that means is Dietary Approaches to Stop Hypertension. That's the acronym. Looking at grains and vegetables and fruits, keeping sweets to a minimum, and that type of plan really is beneficial. So where should your calories come from? You know, a quarter to 35% maybe from fat, but not saturated fats. Keep those to a minimum of 7%. Looking at about half the calories from carbs, but if you're going to choose a carbohydrate, choose one that's going to work for you. Don't choose a white rice, potato, or noodle. Choose something darker, wheat pasta, brown rice, the darker breads, because those are more beneficial. They're a little bit more friendly to the digestive system in terms of having more fiber and the digestion, and won't be converted into sugar. And then of course we need our protein at a good 15%. Going to the grocery store anymore is like a field trip. You have to take a look at all the labels, and you're taking a look at the fat content, and is it low fat, is it low sugar, is it low carb? Keep in mind when you're looking at the calorie, you think, oh, this particular slide says 90 calories per serving. Per serving, not per container. Be careful of that, because you take a look at 90 calories and people don't realize, oh, there's 4 servings to that container. I can eat that all in one setting. So be careful of how much you're eating. Our brains don't really realize that we're full until about 20 minutes after we're finished with our meals. So that impulse to take that second pork chop or that second serving of potatoes is there because it tastes good. It's there, it tastes good, you're not full yet. But if you ate half your meal, got up to answer the phone, or got sidetracked, you'd be surprised after 20 minutes you'd come back and not feel like finishing your meal because you're already full, because your brain finally got the message. And look at the content of things. Avoid the stick butters, they're not good for you. Avoid those commercially baked goods, those really good chewy cookies. They're full of trans fatty acids, they're not good for you. And of course, deep fried food. And like I mentioned, the heavy saturated fats, animal fats. Take a look at the monounsaturated and polyunsaturateds of the olive oils, canola oils, corn oils, etc. Those are more healthy for you. Let's not forget salt. Salt, the forgotten killer. This was a recent article. And we used to need salt for preserving things. It's more of a condiment anymore. We have refrigeration, we have freezers. We don't need salt as much as we did before to cure our meats, to keep them good for the winter. But salt is added so much to our foods that we need to be so careful of it, because it involves other issues such as retaining fluid, having the blood pressure go up. So we have to cut back on it, and to really not more than 2,400 milligrams per day is recommended. And take a look when you go grocery shopping, try to stay in the periphery. The things that are more of a shelf life are in the center of the store. Try to avoid those high sodium foods, the chips, the canned soups, the pretzels. Take a look at buying low sodium foods. You didn't come by this very quickly. So we can't back out very quickly, because sometimes we're just not going to be successful if we try to do that. Take small steps, make small changes. Like I mentioned, take away the salt shaker from the table, or make one change in your diet or level of exercise. Take it from there in weeks at a time, and you'll find that you'll get benefit over time. As I mentioned, diet and exercise, 2 cornerstones to lifestyle modification. And if you follow a healthy diet, and if you are more active, and if you refrain from smoking or the use of any kind of tobacco products, you will reduce your heart risk. And if I didn't mention it, need to lose weight. You need to have changes in the diet. Need to limit the salt. Be more physically active, in moderation in alcohol. All these things will definitely reduce your heart risk that we're able to treat, but it's difficult, so we want to prevent them if we can. High blood pressure, high cholesterol, heart disease. they're serious conditions. They affect both men and women. So we need to be very, very careful about not crossing that line if we can avoid it, and if we have to cross that line, to get the right treatment available. So your health care provider can definitely provide you with the guidelines for prevention and control.